Hello. Hi. Happy Monday. What's up? Hi, Kayla. XO Michelle. What's up? Happy Monday. Hi. What's going on? I literally have nothing to talk about today. We're just eating lunch. I'm Stephanie Waite, therapist, eating disorder specialist. I go live on Monday for a few minutes while I eat lunch, kind of just chat, see if anybody has any questions, talk about random things. Kayla's here, just trying to get through lunch. Well, that's why we're here, right? To help you get through lunch. I think that distraction can be really helpful. You know, if it's a rough day, it can also be helpful to just have like support and know you're not alone, you know? So you're not alone. I'm glad you're here. But we are live on Facebook. I have a private Facebook group, Unfuck Your Body Image. It's people in recovery who are, I always say that the hardest part of recovery is like the body image piece, right? This kind of like, because having an eating disorder puts you at war at your body. So I think that that's why it's so hard that piece is so hard, because you have to do a lot of work to make peace with your body. So that's really what this group is about, is support for folks who are struggling with that or who are in eating disorder recovery. So we're health at every size, intuitive eating. So we're live in that group. I'm live on TikTok. I'm live on Instagram. We are live on YouTube. It's really fun and really cool. I sit here and eat my lunch and we all hang out. So how can you work through feeling uncomfortably full, but you have to keep eating? So fullness happens in recovery when you're like weight restoring or food restoring that kind of part of it. I don't want to say it's at the beginning of treatment, but it's a place where you're needing to really focus on the food that you are eating, right, to get your body back to its nutritionally good place. So fullness cues can feel really confusing. And I think that it can be helpful can you use distraction? Can you journal during that time? Are you able to talk about some of those feelings that are coming up for you while eating? Remember that fullness is a very temporary feeling. It's also a very normal human. Every single human walking on this earth from the beginning of time until the end of time has fullness. We get overly full. That is, again, a very normal human feeling. So if you're feeling overly full while eating, it's not a bad thing. It's just a human thing that happens. It is a feeling that will pass. It's not good. It's not bad. It's not right. It's not wrong. It's just a normal feeling that you're having. It's okay to feel that way. Can you, if you need to, take a moment to take some deep breaths and get yourself, regrounded in your body to get out of your head if you're really in your head during that time. And I think if you can, like, talk to somebody during that time, right? Like, have the support to, again, help validate some of these things, that it's okay to feel full. Fullness is a normal feeling. Oh, you can hear now? Okay, good. You came back from vacation and you went to the beach, soccer girl. Yay! How fun. Oh, hi on TikTok. Any advice for being in recovery while also moving away to college? That is a tough transition. I see it happen all of the time. I work with a lot of high schoolers, and there's a small four-year college in Sherman, Texas, Austin College, yay, Ruse. And so I love their student population. And so we often see folks go from high school to college, or, you know, even like semester change is hard. You know, even I hate it. I hate that y'all can't stay in your dorms all year round. Don't get me on that soapbox, but because I hate even like that big winter break or those summer breaks, like those transitions can throw you off. So, hold on. Y'all, I'm eating a grilled peanut butter and jelly sandwich. I would highly recommend. So, have a plan, okay? You cannot possibly plan for everything, but think about the things that, okay, what are the things that make you feel really good, really balanced, really okay? What are the things that help you feel, you know, like you're in charge, you're motivated? You know, make a plan to do those things. Can you write down a list of potential triggers or stressors or hard things that you're going to encounter during that transition? And then have a plan of 2 or 3 or 4. I like a list of 5 if possible. You know, things or people you can reach out to should you encounter one of those triggers. And also have maybe a small list of support, a therapist, a counselor, a parent, a recovery support group. The Recovery Academy, for example, has a really amazing recovery support group, but it's a group of people who get you and know your challenge and have that list. And so should you stumble, should you have a hard time, you know who you're going to reach out to help you, and know that it's okay to have a hard time. Transition is like a change in your routine. It's a change in new things. Your brain does literally work harder during a change and a transition like that, on top of already working hard going to college, right? So your brain's just like, it really truly is overwhelmed. So be patient with yourself, be compassionate, be understanding, and have that plan and use it should you need to, and use support. You're not working today. Good for you for taking a day off for anxiety. I did that very recently myself, and I am glad that I did. So good for you, Kira Wilson 339 on Instagram. Being on vacation is amazing, right? But it does keep you away from your treatment team. Maybe having a plan with your team, like should you be away for the summer? Because that happens. I have clients that go to camp or all kinds of stuff. So, is there a way to touch base through email, text message, just kind of like a check-in should you need it? That's okay to see and ask for. Certainly, I do that with my clients. Tips on eating when you're not hungry. Mechanical eating, and I know that's so not the fun answer, right? But I think sometimes it's knowing that our bodies need food, and hunger hunger can accomplish a lot of different things, not just making our stomach feel better, right? But it can help us have more energy. It can help us get more focus. And so it can help us have the energy to do things for the day, right? So it's kind of just saying, you know what, I'm going to just show up and take this next bite. And if I can do something like watch a TV show, join Dr. Steph on live, do something to kind of get your head out of the game a little bit and getting into something fun. That can help to ease the boredom of mechanical eating. You want to be an eating disorder therapist? Yay. So, graduate school for a master's degree in psychology. My path was very not traditional. I have a master's in forensic psychology because I wanted to work with victims of crime, trauma. And the Chicago School of Professional Psychology, where I went, had a trauma, specialized program track kind of situation. And this was back when there were only a few forensic psych programs. So got my master's degree and then became licensed in my state. Worked for a few years in the field, I think if you're a therapist, it's beneficial to work in all different types of settings, work outpatient, work in a hospital, work in a higher level of care. You don't have to do that. I did all of that. I worked in all kinds of different settings, worked for the insurance company for a little bit, even did the admin side of things. And then I started my private practice. And at that time, I sat down with a colleague who asked me if I knew about working with eating disorders. And I had helped start the program at Timberline Knolls and had, worked with it some. But I was like, this is a really specialized disease. And I certainly I felt like I was an eating disorder expert given my time at Timberline Knolls. But, I don't know. I think if I want to do something, it's just me. I want to master something, right? I want to really know something. So you can become a certified eating disorder specialist through the International Association of Eating Disorder Professionals. So it's kind of like going back to school. You have to take some classes. You have to get supervision. You have to take a test. You have to have letters of recommendation. It's a certification process, but that allows you to become a certified eating disorder specialist, which helps with, insurance issues. You don't have to necessarily accept insurance, but it kind of allows other benefits to be used, even if you're out of network. It also, I don't know, there are certainly eating disorder specialists out there who are not certified and who are amazing. So if you don't want to be SEDS, just get a bunch of training on eating disorders. Find an association around you and, all the CEs that we have to have, attend all the eating disorder conferences, attend all the eating disorder trainings, because that's what it is. It's on your own additional seeking and learning, and whatever then you feel qualified to say makes you an expert. For me, right, to have the SEDS feels like I can say I am an expert in this. So that was for me, but certainly you don't need that to be an expert in eating disorders. I'm having grilled peanut butter and jelly for lunch. It's really good. I highly recommend. Where did I go? What did I go to college for? I went to Baylor for psychology. I knew I was going to be a therapist, and then from Baylor went to Chicago School up in Chicago. Worked and then got my PhD from Walden University. I have a tip for starting recovery when you don't feel ready. Okay? Let me take a drink of water, gut. I want you to go to recovery-academy.com. That is a place where I have and I teach everything I know about eating disorders and the treatment of eating disorders in a way to you, right? Like I take all the clinical stuff out of it and I kind of try to break it down for you, like in your day-to-day life. I have a free course that is currently at the website I just gave you, recovery-academy.com. And the free course is like a 3-part video training where I talk about, like, I kind of, this idea that of why you want to change your body and that you don't need to change your body. And here are some things you can do to start changing your thoughts and feelings about changing your body so that you can live the life that you want to live and like write down instead of waiting until, lose 5 pounds or you can wear that dress, all that bullshit, right? It's saying, no, this is the life I want to live. This is the person that I am and I'm worthy and I'm enough and I'm going to do that. I can do that right now. I don't have to lose 5 pounds. Yes, clinical social workers can be an eating specialized clinician. What I love about IADEP, International Association of Eating Disorder Professionals, is they have certification tracks for all different types of professionals because in eating disorder treatment, it requires a team, a dietitian, a therapist, a psychiatrist, a doctor, and then, depending on other things, right? And so they have a certification track for different professionals. So if you're an MD, you can become a SEDS. If you're a dietitian, you can become a SEDS. A clinical social worker, any kind of, I think it's just like a master's degree, like a licensed mental health professional. So it doesn't necessarily have to be like a, licensed LPC, right? It's any kind of licensed mental health professional can get it, registered dietitian. And I think they even just added like art movement therapist because there is such a somatic body piece in treating eating disorders. Like it's not just about eating and it's not just about like not wanting to change your body. It's about feelings, and feelings are felt when you have an eating disorder in your body. And then you have trauma, you feel that in your body. And I always say I can treat the brain all day long, but if we don't also treat the body, we're not fully treating mental health, because mental health is a mind-body issue. It's all connected. So you have to, yes, trauma-sensitive yoga. So does the IADEP have there? I don't want to speak out of turn about this because I don't know that IADEP has trauma-sensitive yoga certified eating disorder, specialists per se. But I think they do have it for similar, like not like a licensed professional or not a doctor. So they have something similar like that. And if not, I would hope someone is working on that, because they would very much agree that yoga and trauma-sensitive yoga and trauma-informed yoga is such a wonderful way to treat eating disorders, which is why my practice is we're bringing in yoga and eating disorder for yoga, or yoga for eating disorders and trauma-sensitive yoga, because I really believe in treating the body to treat mental health too. How can you support a friend when they talk to you about their eating disorder? Listen, love them, believe them. Then ask them what they need from you specifically. Like, were they Is there something you can say, something you can do, a way that they need you to show up for them? Do they need you to help them get help for it? Because you're not their therapist, okay? You're not supposed to know about this issue. You're not supposed to know how to treat it. You're not supposed to know the right thing to say. I don't know the right thing to say, and I'm certified in this, right? So it's not about saying the right thing. It's more just loving that person and saying, thank you so much for sharing this with me. I love you, and like, let's kick this thing's ass. What does that look like? What can I do? Read some books and so on your own if you want to, I think NEDA, National Eating Disorder Association, is a great place to start. I do recovery-academy.com, especially because you can find my YouTube channel there, where I have so many videos on eating disorders, just like, talking about them. And that might be a great just information for you to know maybe where your friend is coming from, and maybe learning some language around the treatment in the community for your friend. You're a good friend to want to support them. They're really lucky to have you. Powerful Purple Warrior. Do you have experience with somatic experience therapy? What's that been like for you? There are lots of ways that we can get into our bodies with a trained, you're right, it is hard as hell, right? Because I've seen colleagues do wonderful things. I have a good friend who's like a dance movement therapist, psychodrama, but it's kind of this idea of like really using your body. How can you express these feelings through your body? And there's lots of different creative ways to do that. And I know that I am open to most of those, right? Like I think that we have to let people explore different ways to get into their bodies, because it's such an important part of the work. But our body is our personal experience, right? Like, so how we heal it and express feelings through it is going to look different, I think, for all of us. So we can't say, this is the only way to move your body, or this is the only way to, express this. No, like, cool. But we all feel the same things, but we don't all experience it or express it in the same way. I think that's where we all can differ. If you have eating disorder thoughts, 100% you should get treatment, because sometimes you don't think you meet the criteria for an eating disorder, and you might really truly meet criteria for having an eating disorder. And disordered eating, disordered thoughts still aren't healthy thoughts, right? Like, they still cause you anxiety, guilt, and shame, and embarrassment, and it ruins your day, and it makes you talk shit about yourself, and it makes you talk shit about your body. Like, you have better things to do. Get out of your head and stop being an asshole to yourself, and go out and like have fun and live your life and do what you want to do. So please get help. Is mirror exposure therapy common? I don't know about the word common anymore. Maybe it's still being done. I know I haven't seen it done or heard about it. This is just my experience. 10 years. But again, I think that I think it if you have issues with your body and the mirror, right? If that's like an individual thing for you, how do you live with yourself, I think could be a great treatment goal, right? How do you learn to tolerate yourself? And you don't have to love what you see in the mirror, but how can you at least like smile at yourself and like care for yourself? Because you're going to be living with yourself and looking in mirrors for the rest of your life. I hate the weight criteria for diagnosis of an eating disorder. Trust me. If you took that piece out, the weight piece, and you met everything else, that's an eating disorder. If you feel bad, please ask for help. Sometimes it is hard to get into a higher level of care, to get into a treatment program. Start with an outpatient therapist. If they aren't even a specialist, because you don't have a specialist available, check out Recovery Academy and tell that therapist, hey, here's my situation. This is what's really going on, but like, help me find help. Right? This is my goal. I want an advocate. You don't have to know anything about eating disorders, but I need you to help me get into treatment. Like, can you find somebody to help you do that? A therapist can do that, a school counselor, ask for help to help you. You know, sometimes we have to get a team and other people rallying and like, you know, unfortunately, but you deserve to be heard and you deserve to get help. It's so hard to do recovery alone. Don't. Come join me in my community, recovery-academy.com. It's less than a copay a month. I teach you everything I know about eating disorders, how to treat it, how to like and then I give you worksheets and tools and like things. And then we have a weekly support group where you're going to join me and these other amazing warriors in the community, and we're going to help set goals for you and like help you work through this. Don't do this alone. Speaking of group, it's starting in a few moments, and I need to finish my lunch. So, my dear friends, let me make sure I didn't miss anybody. Okay. Yes, there are often people who have, I work with a lot of clients who have multiple health conditions or have disability or have, you know, other mental health conditions too. Eating disorders are rarely just, I'm afraid to gain weight and I don't want to eat food. Like it's there. Give me that case, please. I would love a case like that, because we're humans and we've been through a lot and we're all fucked up. And so then we add in trauma, then we add in diet culture, then we add in like all this conditioning around us. We are fucked up about food and we are fucked up about our bodies. And so, and then just like living life, right? So anyway, all I'm trying to say is that it is okay that it feels like there are other things that you're managing and juggling. Therapists can help you with that too, right? Like a therapist can sometimes be a great like just advocate and ally for you, just a person who's gonna like cheer you and support you and encourage you and lead you to helping fill in some of these holes for you. Right. And then when it's time to work on the eating disorder, right, when you've got like some of these other things, like you're being heard and someone believes it, that's not even what I want to say. If you're then trying to talk about your eating disorder and the therapist doesn't get it, right, and the therapist can't go into that with you, that's when you need to find that extra specialized care. Recovery Academy, there are therapists all over the country, all over the world. You can message me. You can find me on Facebook. You can find me on Instagram. You can find me on YouTube. You can find me here every week, Monday at 12:15. I will be live to hang out with y'all. And know that the Recovery Academy is there all the time for you. And if you have any other questions, I just told you all the places you can find me. And I gotta go, but I'll see y'all next week. Bye, friends.